Good morning, everyone. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to this morning's World AIDS Day Rock the Women webinar. Today is World AIDS Day. Since 1988, organizations around the world have used this day to increase awareness of HIV and AIDS, so show support for those living with it, and remember those who have died. During today's webinar, we will learn about the causes of the human immunodeficiency virus, HIV, symptoms, the stages, the differences between HIV and AIDS, diagnosis, treatments, and prevention strategies. Joining us today is Sean Patrick Riley, Advanced Practice Nurse at the Babs Siperstein Proud Center. We will begin with 45 minutes of a moderated discussion, followed by questions from our audience. So thanks for joining us today, Sean. I know how busy you are. The center is very busy, and that's always a great thing.
It is. Thank you very much for having me.
Oh, our pleasure. So I'd like to start by asking you to kind of introduce yourself and tell us a little bit about your role at the Babs Siperstein Proud Center at Robert Wood Johnson, Somerset.
Sure. So I'm Sean Patrick Riley. I am, like as you said, I'm an advanced practice nurse, and I've been in healthcare since 2012. I was hired and started about 2 years ago this April, and I am the clinical lead and director right now for our Proud Center, which provides wraparound primary care and that's LGBTQIA plus focused. So, we really focus on meeting the needs of the LGBT community in primary care. And we also do a lot of focused work around transgender health and gender care.
Very good. So can you give us an overview of between HIV and AIDS and how it is transmitted?
Sure. So as you said, HIV is the human immunodeficiency virus, which is a virus that attacks the body's immune system. HIV and AIDS are two different things. HIV is the virus that is in the body, and AIDS is a syndrome that is kind of the end stage of the HIV infection. And AIDS is the acquired immunodeficiency syndrome. This happens when, to talk a little medical, it's when the CD4 count, which is a type of cell in the body, drops below 200. HIV is treatable, but it is not curable. And there are definitely, people who will become HIV positive who will never progress to AIDS. So that is a little bit of the difference. HIV is not AIDS, and AIDS means that you do have HIV, but they're not equivalent.
Thank you for that explanation.
Yeah.
Transmission, can you explain how it's transmitted?
Yeah, I'll talk a little bit about how it is transmitted and how it is not transmitted. The three kind of main ways that it's typically spread is usually through unprotected anal or vaginal intercourse, through the exchange of, bodily fluids of some kind, usually, semen. It's also spread by sharing needles, syringes, and drugs, like through blood contact. And then there's also perinatal transmission, which happens between mother and child in utero. There's a lot of misconceptions, especially early on in the AIDS epidemic, about how HIV is spread, that, we don't want to touch anyone or shake hands or kiss or anything. And that's simply not true. And we know that it's not spread through the air or in the water. It's not spread by mosquitoes or saliva or tears or sweat or urine, or by shaking hands or hugging or sharing toilets or public spaces or sharing drinking glasses, water fountains, things like that. It really is, just sexual fluids essentially, and blood.
Okay.
And it cannot be passed through healthy, unbroken skin.
Okay.
Is the other thing.
So then how would you diagnose, or how is HIV and AIDS diagnosed?
Sure. So it's done through testing. So there are a lot of different testing options, and it can be very confusing. If you walk in and say, "Oh, I want to get an HIV test," There are rapid tests. We kind of all became experts on testing during the COVID pandemic with different options. So we know what a rapid antibody tests are, and all of that language. But the rapid tests for HIV specifically, they're not great. They're not as sensitive and specific as, or rather, they're very sensitive, not as specific as we would like. And it takes about 23 to 90 days for those to turn positive after an exposure. Versus a blood test that we use is called a P24 antigen test. And that will turn up positive around 18 to 45 days. So usually a little bit sooner. And then lastly, more expensive is the NAT, or the nucleic amplification test, that looks directly for HIV in the blood. And that can show up usually around 10 days after exposure. So it is, diagnosed through a rapid or a blood test. The best way to be for sure is a blood test.
Okay. I'm going to jump around a little bit, but
That's
with
all
the
right.
testing, to clarify in the testing, is one better than the other?
Any test is a good test. There is, if the option is to get a non-ideal test or not to test, always, go for testing of some kind. There are tests that are, like I said, they're more sensitive and more specific, meaning that if there is HIV in the blood, it will detect it. And if there's not HIV in the blood, you can rely on that test result and being accurate that you do not have HIV. The one that is kind of the gold standard that we use if we're testing, a patient in clinic, is a blood test, and it is that HIV 1 and 2 P24 antigen test. That is kind of, the gold standard. But there are a lot of, like free testing sites or testing clinics or like mobile testing sites that will use a saliva test or a rapid test. And, they're not bad tests. They just aren't, they aren't as good. They're good, but they're not as good. And you always want to follow something. If you have reason to believe that you've been exposed to HIV, then, taking an off the street rapid test isn't, going to be the best course of action. It's always going to be go ahead and go visit your primary care provider, or go to an emergency room or an urgent care and get a blood test.
Yeah. So how often, and I'm guessing if they're symptomatic, and we'll get to the symptoms in a minute, but how often should someone be tested?
That is a great question, and it is really person specific. It depends on risk factors. It depends on number of sexual partners. It depends on sometimes sexual proclivity. So if you are sexually active with more than one partner, like a non-monogamous way, and if you're having kind of routine unprotected sex, I would say at least every 3 months would be good. We'll talk a little bit about PrEP a little bit later, but every 3 months is good for monitoring. Because as I said, with these tests, if you had an exposure today, getting any of these tests tomorrow isn't necessarily going to be confirmatory, because a lot of these tests take a week or more to come back positive.
Wow. So let's talk about, obviously, symptoms. What are the symptoms of HIV?
Sure. So kind of new onset symptoms of HIV, it can kind of look a lot like the flu. Fevers, chills, you can get a rash. Rashes are common sometimes with viral exposure. You can have sweating at night, muscle aches, sore throat, fatigue. You can see it's kind of a general sick appearing picture that will last, for a few days, and then it kind of goes away. That your body is not physically sick anymore, and then the HIV is in your system, and that moves to stage 2, which we call clinical latency. And people in this stage don't often feel sick or have any symptoms, and they can stay in this stage for 10 or 15 years without treatment and without knowing that that they're HIV positive. Granted, given people's health and just that different people are different, some people will move through that stage faster, and some people, it may last longer.
Wow. So then, given the advances that have been made in HIV prevention, particularly with the introduction of pre-exposure and post-exposure prophylaxis, or PrEP or PEP as we call them, can you explain about PrEP and PEP, like who's eligible for each, how do they work, how do they differ,
Yeah,
and how
absolutely.
effective they are?
Yeah. So PrEP, as you said, is pre-exposure prophylaxis, and PEP is post-exposure prophylaxis. So PrEP is wonderful. It's been around for almost a decade, and it's becoming a lot more popular, a lot more common for people to be on PrEP. And right now there are two FDA-approved pills that can take, and then there's one injection. The pills are Descovy and Truvada, and the injection is Apretude. Talk more about that in a second. But the first one to be approved was Truvada, and this is kind of the one that insurance likes to cover the most. It's the one that is least expensive. Similar to Truvada is Descovy, and it's newer, it's not generic yet, but it's good for patients who might have kidney dysfunction or renal dysfunction. And these medications are, they've got to be taken every single day. It's 100% compliance is always what we go for with PrEP, because we know that when taken with 100% compliance, you're 99% protected against transmission of HIV from sex. Percentages are a little bit lower when we're talking about, the risk from injectables. So if you're an IV drug user, or if you are, someone who's an IV drug user, the risk of contracting HIV is reduced by 74% if you're taking PrEP 100% compliantly. With PrEP, again, with receptive anal intercourse, you're protected after about 7 days of continuous medication. And with vaginal intercourse, it's after 21 days of taking the medication regularly. And again, that is 99% effective at preventing the transmission of HIV.
Now,
I know I was going to touch on the injection, because a lot of people come in and they're very, very excited about the injection because they don't love to take a pill every single day. And the injection you get every 2 months, and it is extraordinarily effective. The problem with the injection is that it is very expensive. It can be difficult to get it covered, because insurance companies will say, oh, well, we've got Truvada that you can take, and it works really, really well. You don't need the injection. But we are, working to get it covered for more people, because it is, again, it's very, very effective, and it just reduces transmission rates significantly, not just from person to person. If you have contact with someone, it protects you just as well as if you're taking PrEP, but it decreases the transmission to another person as well if you do the injection.
So I wanted to just touch upon, you mentioned it's very expensive, the injection. So is there assistance for those who can't afford the medication, or how are they getting that?
Yeah, so the pharmaceutical companies do have copay cards and things like that that can help. And most insurance companies these days are covering PrEP as, active prevention against HIV. But sometimes we have to do a prior authorization or things like that if we want someone to be on injection, or if there's good reason for someone to be on injection. And then, we also have grants that we work with here at the Siperstein Proud Center, and a lot of our grants will help to cover our patients' PrEP medications.
Nice, that's good. That's good to hear. So I know that there's been tremendous strides as well in the treatment of HIV and AIDS over the past several decades, allowing individuals to live long, healthy lives. I think you mentioned that a little earlier as well. So can you tell us
Hmm.
about some of those treatment options?
Sure. And then I'll jump back and I'll talk about PEP because I realized I only
Oh,
really talked about
oh
PrEP.
yeah, we didn't talk
We'll
about
do-
PAP. I forgot. My apologies.
no, you're fine. It was also me. PEP, I'll touch on that for just 1 second.
Sure.
Um, PEP is a little bit different. It's for people, if you know that you have had an exposure to someone who is HIV positive, then it is a way that we can reduce transmission by about 80%. You start taking medications regularly for 28 days. And you kind of take antiretroviral treatment for that month. And if started within the first 72 hours after exposure, like I said, you've got about an 80% chance that you won't seroconvert to HIV positive. And you'll do regular testing. You'll do a test that day. You do a test at, I believe, like two weeks, and then a month, and then at 3 months. And that is PEP. PEP shouldn't be used regularly. So if someone's not great at taking their PrEP, it's not like they can come in and be like, hey, I think I had an exposure. Let's go through the PEP steps again. That person really would be a better candidate for PrEP.
Wow.
Okay, so now treatment once someone becomes HIV positive. The goal for all HIV treatment is to suppress the viral load. So we want to see, a low number of the virus count in the person. The way that we do that is through some of these same drugs that we use to prevent the spread of HIV, which is these antiretroviral medications. The big ones that we see pretty regularly are Biktarvy, Tivicay, and then also Truvada. We want to maintain that CD4 count that I mentioned earlier to prevent kind of the progression to the latent HIV or AIDS. And that is, the ultimate treatment goal is to suppress the viral load, to maintain that CD4 count, and to prevent the progression to AIDS. And we know that if someone does have an undetectable viral load, then it is not possible to spread HIV to someone else. So U equals U is something that we talk about a lot, and that is undetectable equals untransmittable. So you're not going to transmit even if you are in a relationship with someone who's not HIV positive. And if you are HIV positive, if you are not detectable, you're not going to pass that HIV on to the partner.
Okay. Wow. So, what types of services, prevention and treatment options does the Siperstein Proud Center offer?
Sure. We offer routine HIV testing and other STI testing. We have, condoms if people need condoms. We offer PrEP and PEP services. So many patients who are on PrEP, starting patients on PrEP, getting them, kind of ready for the routine of being on PrEP, which includes, getting HIV tested every 3 months and any other, routine STI testing that they might want to do. We are hoping to be able to start kind of like a walk-in STI or PrEP clinic. We're bringing on a new provider here in the next couple months, we were talking about earlier, which is exciting. And we want to be able to expand that knowledge and work with other RWJ sites to kind of expand the access and the knowledge of PrEP and PEP, as well as increasing STI testing. And then, HIV, we kind of can help facilitate and help navigate people to the right direction for HIV management. We don't do kind of wraparound HIV care if someone is HIV positive, but we can, help put them in touch with kind of, social services or other community resources that do offer, kind of full wraparound HIV care. That's part of like some strategic partnerships that we are aligned with.
Wow. Well, and you are a tremendous resource, and we are very fortunate to have you. And I, publicly want to thank you for all the work
Oh,
you
thank you.
do. And I'm always amazed because I do see the Proud Center always wanting to partner to advance the care for our community. So maybe can you tell us about some strategic partnerships the hospital has with other organizations? I know you touched upon it a little bit about within the system, but do we have
Sure.
any other partnerships outside that are making, are helping us to make improvements in the health and the lives of the people that you serve?
Absolutely. We were very fortunate to have an organization like RWJ, who we work with, who really amplifies and promotes the work that we're doing here and supports us in so many ways. And because of that, because of this great corporate support that we have from RWJ, other people kind of take note and they look and they're like, hey, we have some grants and we'd love to work with you to create a grant for your patients. And we've done that with TD Bank. We are working with TD Bank on a grant for new transgender individuals who may not have access to insurance, to help them, pay for, things like medications, labs, visits, that sort of thing. We're working with Sanofi on a grant to expand our ability to provide care. We work with the hospital at RWJ, University Hospital Somerset, to work with their charity care for our patients who maybe don't qualify for Medicaid and also don't have insurance, but still we don't want them to not have access. And that's a part of why we are so close on campus there, is because we have such a great relationship with RWJ University Somerset. We also work closely with people at Hyacinth, which provides free STI and HIV testing as well. Zufall is another great New Jersey organization that we work with regularly, who has Ryan White coverage, which is a specific type of government coverage for people who are HIV positive. They have locations are in West Orange and in Somerville, and they have the ability to for case management. They have dental on site. They have therapy support groups, and wraparound care for people who are HIV positive or who do have AIDS. And then we've also worked with and partnered with Safe and Sound, which is a crisis center in Somerville for women and children. So there's always going to be more. We're always looking for more opportunities, and are very, very grateful for the ones that we're able to promote and use.
Amazing. That's fantastic. Again, thank you for all that you all do. And at the center, we really appreciate it. So now I'd just like to open it up to questions from our audience. If you have a question for Sean, you could either put it in the chat or, open it up. I'll give everybody a few minutes to see if there's any questions.
Sure.
Well, I'll just have one while we're seeing if there's anybody else has a question. So what is the biggest takeaway that you want people to know for World AIDS Day today?
I think, we have the medication, the science, the technology, the ability to actually eradicate HIV in, this generation, in our lifetimes. And the way that we need to do that is by increasing access to testing, increasing access to treatment, and increasing access to prevention. And it needs to become less of a specialty. It is incredible that we have the Babs Siperstein Proud Center here, but it shouldn't be a special, unicorn of a place that exists that people are like, oh wow, I didn't know they had that. We need to be educating all healthcare providers and educating people early on. Comprehensive sexual education early, so that people know, get tested, what their risks are, and how they can protect themselves. My biggest takeaway always is that HIV prevention is HIV testing. So knowing your status, knowing if you are at risk and taking steps to prevent that, getting that test, that first thing, that is the first step to prevention. The other thing is just decreasing stigma, like throughout. It's difficult to really understand the full implications that the early days of the AIDS crisis and AIDS epidemic had on people within our community, specifically, my community, gay individuals, gay men, because it was seen as such a taboo. And we know now that AIDS and HIV does not only affect gay men, it affects people of all sex and genders. It affects people on every continent and every country and every slice of our humanity. So talking openly about HIV, not keeping it a secret, destigmatizing it so that people don't feel shame when they're seeking treatment or seeking care, that is vitally important, because the more that it stays in the shadows, the more people think, oh, well, it's not there, or it's gotten better, or I don't need to worry about it. I think when people see the faces of people who are HIV positive, it will surprise them, because it is, it's not always who people imagine it to be. The other step is, you need to take action. So, being active, doing things on World AIDS Day like this, staying educated, staying up to date, that's important. And then providing support. Finally, if someone is HIV positive, it can be extraordinarily isolating because of the reasons I talked about with stigma and just a lot of minority stress, minority sexual stress, having to get treatment, having to go to doctors all the time. It can be a big burden. And with people wanting to hide it, it's a burden that some people carry alone. So again, being a safe space and providing support is tremendously important. You can volunteer with local organizations, you can pledge, you can donate, you can help correct misconceptions if you hear them. Speak up for people who may not be able to speak for themselves.
Well, thank you. That's a wonderful message, and we hope that we could spread it and push that out for everybody. Yeah. Well, I am not seeing any questions being posted. So
Okay.
if there are no questions, then this will actually conclude this morning's webinar. So thanks so much, Sean, for joining us and for this enlightening discussion. I mean, you are so informative and such an invaluable resource.
Thank you.
I'm glad that you're part of the RWJ Somerset team. And let me just—
I'm thrilled to be here.
Oops, just a question. Comment: the understanding and acceptance of this medical circumstance has progressed beyond belief. So thanks to you, and thanks to our audience for joining us. We really appreciate it. Just remember that the opinions expressed here by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 1-888-724-7123. And for more information about healthcare services at the Siperstein Proud Center, please log on to www.rwjbh.org/Somerset Proud. On behalf of Robert Wood Johnson University Hospital, Somerset, thank you all for joining us today, and have a great day. Take care, everyone.